Hi, so if you're watching this is our weekly newsletter, and I'm Dr. Sunny Dhesi at Vysana. So, hi Barbie. That was one of the interesting trends that one of our patients shared with us. Barbie Botox, a trend that I hadn't heard of until it was shared with me, and very interesting, but I will talk about that at the end. What's been happening in clinic? So we are still moving over CRM, things are running over smoothly, hopefully things will go to plan. If there are any disruptions, I apologise in advance. You will also notice if you're coming into clinic that there are some changes afoot in terms of refurbishment, making it a little bit more comfortable, a bit more homely. For those of you coming in and are waiting for an appointment, please keep your eyes peeled for those changes, and apologies again for the disruption. We may have to ask you to wait in your car temporarily on a couple of days as things are going on, but we will minimize it as much as possible. What are patients asking for in clinic? Skincare over the summer has been a big thing, obviously SPF, and now that the weather's changing or has stayed the same, the sun is less out there, we're now reverting back to more nourishing skincare. So we're talking about using things like thicker or stronger emollients. Illumier is a very good example, the recovery balm, or the combination cream, or thicker moisturizers from Teoxane or from Barbie. So if you have any questions about that, please do ask. You might want to now start stepping up how much more intensive your moisturizing is, just because of the change in weather. As the temperature gets colder, the heating comes on, skin can dry out, and then you might notice that change. The other thing that we've been doing a lot of is wrinkle relaxing injections. And now we're starting to doing peels. Now we have been bringing back into clinic medium depth peels. Now these peels do have downtime to them. They involve an active product and they're called TCA. They're not particularly painful at the time of doing them. It's just that the downtime with them is that you will peel and you will shed. I can tailor the peel to how you want that downtime to be managed, but this is what we're noticing now, because now is the time to try and start removing that sun damage so you can really nourish the skin leading into winter. Charlotte has been doing quite a lot of fillers, dermal fillers, as have I, restoring facial volume loss, and it's more tweaking at the moment, just certain areas. So for example, the upper lip line or the frown lines we're doing more often because, let's say, face it, we have ultrasound in clinic, and ultrasound allows us to visualize what's going on in the skin. We are the only clinic in Rutland and probably Leicester that has ultrasound. So if you are thinking about dermal fillers, be rest assured that when you come in, we will always ultrasound you to make sure that we can visualize big blood vessels like arteries that don't need to be injected when you're having dermal fillers done. And then the other thing that we've been doing is nanofractional skin resurfacing. So using the Venus Versa and resurfacing skin, helping to treat pigmentation and fine lines. So again, our treatments, the way that I've designed them is to match what your concerns are, but we don't just sort of pick an off-the-shelf treatment, we adapt it to what you need. So whether it's wrinkle smoothing injections, whether it's peels, whether they're superficial peels or medium depth peels, whether it's skin resurfacing with our Venus Versa, whether it's dermal fillers or skin boosters like Profilo, what I'm trying to do is tailor those treatments according to what your skin is doing. And as I've spoken to a lot of you, skin changes in the season. So your skin is different in spring, your skin is different in the summer, your skin is different in the autumn and the winter. And even more so, the physiological changes that happen for all women, your menstrual cycle, if you are still having a menstrual cycle, even if you are perimenopausal, you will start to notice that your skin changes during the time of the month in terms of your menstrual cycle. So we tailor those treatments according to that. So that was just an added insight into how I formulate skincare plans and skincare treatments. And on a lighter note then, hi Barbie. So Barbie Botox, you may have come across this trend. So I thought it related to having, completely sort of plastic finish or smooth finish to your frown lines or your forehead lines, but it's not actually that at all. It's actually having Botox into the trapezius muscle. And what that does, I haven't got exactly huge trapezius muscles anyway, but what it does is it allows the silhouette of your neck to be a little bit longer. Now, this is not a treatment that I would advocate for cosmetic reasons, and only because there are nerves and veins that run there. However, for those people who suffer from migraines, posterior migraines that start here, injection into the trapezius muscle or into the base of the neck actually does help. And because the theory is that the tension in the trapezius, the tension in the neck, is what's causing the migraine. With any of those things, you want to go to someone who has a good anatomical knowledge, who's done it before, who understands not only the benefits, but the risks as well. I just wanted to finish on thank you so much for those of you who showed interest in the trial. Spaces did fill up very fast and more spaces will become available. If I haven't got around to talking to you about it, if you have inquired, I will do so. But just at the end of this newsletter, what I wanted to say is that it was a medical screening type program. Now, my focus in clinic is to match treatments to your needs. But a big component that was missing, and a thing that I do as a GP all the time, is management of perimenopause and menopause and postmenopausal symptoms. Now, HRT, or HRT in general, is not always a magic bullet. My view is that it's something that we should advocate through the NHS. I do it as an NHS GP, and that's where I have directed quite a few patients, quite a few of you watching this newsletter, back to the NHS to get your HRT managed there. But what I'm thinking about is the next step. It's terms of longevity, 10 years from now, 20 years from now. We want to work backwards, say, for example, where do you want to be in your 50s, your 60s, your 70s or 80s? Where would you like to be? How fit would you like to be? How healthy would you like to be? We want to avoid things like cardiovascular disease, heart attacks, strokes, Alzheimer's, dementia. And now this program that we're working on, and some of our very kind volunteers are trialing for us, is having blood tests to look at biomarkers. So please keep watching. I will share more with you. Very exciting results, I'm sure, to come through. And if you are interested, drop us an email, and I've prepared a more informative pack or information pack to go out to you if you are interested. For those of you who are interested in the trial, there was a cost involved, and that was just for your blood tests, and everything else we are doing that for you. So anyway, I hope you've enjoyed this newsletter. Please do share the newsletter with anyone that you think would get value from it. Please like, comment. If there's anything you dislike, please also say that as well, because I only thrive off your feedback. And I wish you a good end of the holidays, and it's back to business, I'm sure, for a lot of you in terms of school, if you have children, or back into full pelt for work in September. And I look forward to seeing you in clinic. Thanks very much.